So, you're a diver and you take ADHD medication. Can you do both safely? That's the big question, right? It's a huge deal for so many of us in the diving community. In this explainer, we're going to break it all down. The risks, the readiness checks, everything you need to know about diving on stimulants like methylphenidate.
Yeah, this is the question that brings you here, isn't it? If you're taking something like Ritalin or Concerta, you've got to have a clear, straight answer on whether it's safe to dive. And let me tell you, it's not a simple yes or no.
Okay, so here's the short answer. A lot of the time, yes, you can. But, and this is a really, really big but, it's not just an automatic green light. No way. It absolutely positively requires a diving-specific medical assessment. So what in the world does that actually mean? Let's unpack it.
All right, first things first. To get a handle on the risks and how to manage them, we've got to understand what your medication is actually doing in your body, especially from a diver's point of view.
So methylphenidate is a stimulant, right? And for divers, that creates this real balancing act. On one hand, it can kick up your heart rate and blood pressure. But on the other hand, it's prescribed to improve your focus. Then you've got these other effects, like it can sometimes cause anxiety, or, and this is a huge one, it can totally suppress your sense of thirst. Now, every single one of those things has a direct, major implication when you're 30, 60, or even 100 feet underwater.
Okay, so let's get practical. Instead of looking at these effects as big, scary roadblocks, let's reframe them. Think of it like a pre-dive safety checklist. For every potential risk, there's a clear, simple readiness step you can take to make sure you're diving safely. First up, let's talk about your heart. The risk here is that the physical work of diving, imagine you're finning hard against a surprise current, could spike your heart rate or blood pressure to a dangerous level. So, what's the readiness check? Well, it's a two-parter. First, you absolutely must have medical clearance confirming you've got no uncontrolled heart issues. And second, you manage that risk in the water. How? By planning conservative dives and avoiding stressful situations like, trying to do too many things at once underwater.
Next up, the mental side of things. For some folks, stimulants can dial up anxiety. The risk is, how's that going to hit you during an unexpected underwater event? Picture that sudden cold shock when your mask floods out of nowhere. The key to being ready for that, it's all about stability. You need to have been on a stable dose of your medication for weeks, maybe even months. And those emergency skills, they should be so practiced, so rehearsed, that your response is just calm and automatic.
Now, let's talk about something we all need: sleep. Stimulants can mess with it, and trust me, diving while you're fatigued is a serious risk. It makes you more vulnerable to stress and even decompression sickness. The readiness check here, it's simple, and it's totally non-negotiable. If you haven't had a good night's sleep, you just don't get in the water. End of story.
And this next one, this is absolutely critical. The medication can make you not feel thirsty. That's a huge problem because dehydration dramatically increases your risk for DCS. You literally cannot trust your body to tell you when you need water. So your readiness plan has to be active. That means you're drinking water on a schedule, almost like it's a chore. You do it before your first dive, and you make it a priority during your surface intervals.
Okay, so after talking about all those risks, here's a really fascinating twist. For a lot of divers with ADHD, being properly medicated isn't a liability at all. It's actually an asset. That enhanced focus, the ability to think through tasks step by step, it can make them safer, more aware, and more capable divers. So when it's all well managed, the medication can actually reduce risk, not increase it. How cool is that?
All right, let's pull all of this together then. What does a green light to go diving actually look like? What are the specific conditions that mean you're good to go for a safe and awesome dive?
So here it is. This is your ideal green light scenario. Diving is considered low risk when, and this is important, all of these things are true. You're stable on your medication, you have no significant side effects like palpitations or panic, you have no underlying heart or seizure issues, you've been cleared by a doctor who actually knows about diving medicine, and you're planning on doing conservative, no-stress dives. Remember, it's not just one or two of these, it's got to be the whole package.
And just as important as knowing when to go is knowing when to call it off. This is your red light. If you've just started your meds, or your doctor just changed the dose, if you're feeling any weird side effects, if you're tired, sick, or dehydrated, or if you have a history of panic attacks, today is just not your day to dive. Safety first, always.
So we've gone through the medication, the checklist, the green lights, the red lights,
And it all leads to one final, really empowering takeaway about taking ownership and making smart choices.
So, if there's one thing you take away from all of this, let it be this simple phrase. Safe diving on this medication comes down to 5 pillars: stability, self-awareness, hydration, conservative diving, and the right medical clearance. That's the formula. Stability, self-awareness, hydration, conservative diving, medical clearance. Got it?
And that leaves us with one last, really important question to think about. This isn't just about what you can do as an individual. It's about the entire diving community. How can we, as instructors, as dive buddies, as boat captains, create an environment where neurodivergent divers feel safe and supported, where they can talk about their needs without feeling judged? That's how we make sure this incredible underwater world is accessible and safe for absolutely everyone.